It was August of 2019. We had left a party and came home, and he had a stroke. That was stroke number 8.
So my first TTP experience has also been my only TTP experience, and I hope that it stays that way. So I've only had one acute episode. It happened, I can tell you the day, it was July 27th, 4 years ago, in 2017. I had been feeling for a few days very, very tired and very, very out of it. I had no energy. And my wife had wanted me to go to the hospital. I had just come from the hospital a few days before with an infection, and I was feeling terrible. And I wasn't really getting any better. I was feeling worse. And then the morning of the day that I ended up going back to the hospital, I had noticed what I now know to be petechia and purpura all over my body. My urine was rust colored and not normal, and that was a bit alarming.
My first experience with TTP was in November of 2000. I was on the west coast of Florida on a weekend vacation, and I was just about to board a dinner cruise with my husband when he came back from the bar with our drinks, and he noticed that I couldn't speak. I was just stuck in, like, frozen, and no words would come out. My left side was frozen, and he just looked at me and said, "I'm calling 911.
We were there about a week before they figured out that that's what it was, that he had TTP.
Because we just don't know what was going on. We had no idea. So being there for a week, when they did finally diagnose me with the TTP, we started getting different treatments there. I have never heard about TTP.
I was in the hospital for weeks, and I had a really bad time of TTP. So I had the classic pentad. I had all 5 of those symptoms. I ended up having 2 mini strokes, 2 seizures. I was in a coma for a while. I wasn't expected to live.
And I went to a place called the Cleveland Clinic. And after many tests, blood tests, bone marrow tests, all kinds of invasive tests, they came up with the diagnosis of TTP, which nobody had ever heard of before, including me. And at that time, they started the plasmapheresis exchange immediately, which is done by the Red Cross over there. And they started me on steroids. But back then there was no Rituxan. They had given me a different kind of chemo, which you lose your hair with, which was no fun. And I was in the hospital for about 5 weeks before my platelet count was at 150 for 3 days, and they released me. And that was the first of many, many episodes.
And he just stayed there for another 2-3 more weeks. They just did the plasma exchange every day. And then finally, when we got to those last couple of days, right, and then finally the numbers started coming up. So it was kind of scary. It was kind of scary because when I came upstairs and the room was full of people, and I was just I didn't know what was going on.
And at that point, they had figured out, and whatever they was going to try or what they was going to do, I was all willing to do whatever they was going to do at that point, because with the strokes, it was really serious. Like I said, just whatever they wanted to do at that time, it was, go for it.
Nobody got any answers to that. So it was just kind of perplexing, how did I get such a rare thing? And was it, anywhere else in the family? But no, we couldn't find anybody else that had ever heard of it, much less had it.
Oh, much, much better. I've been feeling fine, actually. So I do feel that maybe I'm not 100% like I used to be, but I'm thankful, that I'm alive. So to come out of it at all, I'm grateful. But I do think I'm probably not 100% the way I was beforehand. I don't think I have maybe quite the same focus, maybe quite the same mental stamina. You make adjustments, but I'm happy to be alive, and I'm happy to be in the shape I'm in, so I can't complain.
One day, everything's okay. I don't feel anything. The next day, next 2 days, I might not feel too good. I'm just taking it day at a time, just take my medication and everything like I'm supposed to.
I'm doing good. I just had my relapse in April of this year. Finished my 4 rounds of Rituxan, and it was the first time that I had not had to be hospitalized because of the Dr. Sucker's recommendation to watch the Adams 13 as opposed to watching the platelets. So that was a revelation for me. Dr. Henry and Dr. Suker consulted on the Adams 13, and when that level dropped from 100% to 47%, they started the Rituxan, and I never ended up having to go to the hospital or get the plasmapheresis or the steroids. That was life-changing for me. First time ever in 21 years that I've not been hospitalized.
It's hard and not understanding things, what was going on, what was taking place, and dramatic experience for me that I never encountered before. And Dr. Zucker was the first doctor we saw, and he kind of reassured us. He grabbed Kenesha's hand. He said, "Kenesha, we're going to get you better." And that was just so reassuring just to hear those words from him, because it was like a roller coaster, up and down, up and down. One day it was a good report. Next day the numbers dropped, and then numbers go up, and it was just back and forth, and we didn't know what was happening. Just was praying and everything would work its way out, and that's what we just kept our faith, and that's what it was like. It's pretty good because, believe it or not, like Kenesha said, we're more on top of it. Dr. Zucker stays on top of it, make sure she gets her labs regularly, and just to make sure everything is okay. Kenesha, she's our number one advocate of knowing when something's not right with her body or if something feels different. So it reassures me that, I know she knows what to do when she's not feeling right.
Well, I don't know if everybody gonna have a patient like I have.
I don't listen. I'm hard-headed.
Well, if you want to ask Dr. Ngala, he's very hard-headed. I think if he wasn't so hard-headed, we probably could have found this a lot earlier. A couple of times, I think a doctor got close to it, figuring out what was wrong with him, but he wouldn't stay in the hospital long enough for them to figure it out. I think that last time it really scared him, and he was like, okay, I gotta stop, And when he got there, and I said to him, you have to stay here and let them figure it out, And I had even said to him, I said, me and Dr. Ngala had a little side conversation, if I was going to have to, be in charge over him, whereas he wouldn't be able to be. I said, because Dr. Ngala, he's scaring me. I couldn't sleep because every time he would move or he'd jump up, I'm thinking something's wrong. Is he having another stroke? And and I don't think he realized he was wearing me down.
Lisa's right. I was being hard-headed. Dr. Ngala was right. But, I wasn't taking it as serious as I should have been. But you can best believe I'll take it serious a lot more right now.
So I started working with patients with TTP in January of '94. So it's going to be 28 years coming up, long time. So I think the most difficult part is knowing how serious the disease is and having to convey that to the patient and to the family without scaring them. Because once they're here, we know how to treat them, but unfortunately, some of them will come back with another episode and another episode. And what I do myself is to talk to them and to answer questions and to understand that different patients understand differently what they have. And so I try to answer questions, whatever questions they have. And sometimes people say, oh, I have a simple question or I have a silly question. You say, well, it's a question, it's not silly. You can ask anything. So try to see what's important for that particular person and what is it that they want to know or that they haven't yet understood. And I try to explain that now that they're here, which sometimes took a while for them to get here, and now that they're seeing us, it means that they're having or already had plasma exchange, which is, as of now, the best treatment. So I say, now you're much better than you were before you got here. A couple of things. This new drug, caplacizumab, has made a difference. I do think patients are going home earlier. It does seem to help. Not sure how available it is everywhere because it's a very expensive drug. So if they can get that, if it were me, I would get that drug if I was offered. In our institution, because of Dr. Zhang, we have the ability to do the ADAMTS13 test, and that made a big difference for us because we know what their level is before they go home, and we have studied also in Dr. Zhang's lab to understand what it means to have the enzyme level before going home in terms of having to come back. So that has made a big difference for us. It's important to know that this could be a chronic disease. The ones that survive the first episode may have multiple other episodes, and they may be treated and go back home, but they do need to be aware that every time they have a relapse, it could be very serious. So they cannot take it for granted that they got better before, so now this time they don't have to go to the hospital right away. So patients need to know, patients and families need to know that every time they have an episode, it could be very dangerous.
It's really life-changing because, I'm gonna get a little emotional. For like 20 years, nobody else knew what I was going through. Nobody. You can explain it to people, but they don't get it. But that's what I say about TTP being such a support group with the Rewin Foundation, because only other people that have gone through it can understand what you're dealing with. It's just not possible to explain it to anyone else.
But the Rewin Foundation, I must say, has really educated us. They've been there every step of the way. We're just so happy and glad to be the part of the foundation, because I can't imagine life without it at this point. But we really, really truly appreciate what the Rewin Foundation has done and continues to do.
Learning about the Rewin Foundation and learning about the story of its founding, and then just the people have been wonderful. It's been a great experience for me to get to talk with and know and just be with other people who understand exactly what you've gone through or you're going through. And it's been fantastic. It's been a fantastic support system for me. That's the most concise way I can say it.
We're very thankful for your organization. It has been very helpful to us, to our family, to understand what he's going through and what we're going to have to go through. It may never come up again, okay? But then again, it may come up again. We know that you guys have our back, and if we need anything, you guys are going to be there.
When I hear and meet new people and hear their stories, I think it's kind of crazy, because sometimes in situations you hear stories and you're like, oh my gosh, I went through that same thing, or oh wow, I didn't go through that, but that sounds crazy too. And I think that it gives me a lot of hope to think that at the end of the day, we all went through something traumatic and all went through like a life-changing experience, but we're all still here today and able to tell our stories to each other. I just want to add, for anybody who's living with TTP or currently going through the situation, is that you have to continue to keep faith and have hope that everything is going to work out and get better. Because sometimes, it might seem like, you're at your lowest point or no one's going to understand, but don't be afraid to be too alert on yourself. If you feel like you want to get some blood tests done, call your doctor and ask, can you get some blood tests done? You know your body best. You have to pay attention. And you also are not alone.
We love you.
We love you too. From the Rewin Foundation, we love you guys.